You know, thank you. Our quarterly training on our three wellness solutions that we're featuring this quarter. You're going to get to go in depth a little bit with some research studies, why these formulations work the way they do. And this session is about feedback that we receive from a number of practitioners. They always want to go deeper into our formulations, deeper into the wellness solutions, and understand even more about how all of these great formulas help support the body and have an impact on their patients. And our incredible outside team can only spend so much time with you because you're running from patient to patient. So what we decided to do is to not only have Jamie and Joe record videos that are available on our website that go into each of our wellness solutions that are featured this quarter, but we also have this call that we're setting up at least once a quarter to go over some in-depth research that supports a lot of what Joe and Jamie presented in those solutions. As you know, Nutritional Frontiers is really committed to education. We are actually adding more online offerings and additional education opportunities. In fact, we are starting a webinar series for those of you that can't make a Friday 9 a.m. We're going to be doing a Thursday 7 p.m. Once a month on a Thursday, and we're going to kick it off with Dr. Verdialis in May, and we will be sending you out information about that too. And she's going to talk to us all about incredible ways to live younger, longer, and have great sex, I think was the ending. So I know it's a little early for that, but you know.
Never too early. Come on.
Maybe not, maybe not. But we will get you all of the details on that presentation in May. So we are going to focus this morning on our three wellness solutions that we're featuring this quarter: cardio solutions, bone inflammation and joint, and immune and allergy. So without further delay, I think we've given people plenty of time to jump on. Again, if you have questions, just put them in the chat. And we will get to those at an appropriate time. I'm excited. Dr. Len Brancewicz is an incredible addition to our team. He really supports us with formulation ideas, with research, with speaking engagements, and we keep pulling him back out of retirement when we can get him off the golf course. So we were lucky to pull him in this Friday because it is a gorgeous day, and I'm staring at the Tarpon Springs golf course.
Beautiful. It is gorgeous out. Yeah, I know.
All right. Enough of the weather.
All right, Dr. Len, if you want to take it away.
Yes. Hey, I got everybody to have a homework assignment first. When you have listened to the themes that have come out for this quarter, and a couple of the pieces that came out talking about stress and how stress can affect all three aspects of these quarterly focuses. And if you've watched the news last night, you know that the Middle East is in the middle of a meltdown. So your homework assignment for this weekend is to get your Bible out and go to Ezekiel chapter 38. I want you to read that. I want you to just approach that because there's certain stories in there from a story that was written over 2,800 years ago about what's going on right now. And just so you know, some of the words you hear, one is Gog, G-O-G, that is Russia. Meshach is Turkey. Tubal is Syria. Gomer is Lebanon. And Persia is Iran. And it talks about how Israel gets attacked from all sides. Predicted 2,800 years ago. But when you read that, I want you to read the outcome. Know that God's got this thing. Now, there's a myth going around. There's a myth going around in medicine nowadays. I hear it from all of my professional friends that you need a specialist for everything that goes on. If you have allergies, you need to go to an ENT. If you have bone and joint issues, you go to an orthopod. If you have cardiovascular issues, you go to a cardiologist, right? That's the way medicine rolls. But we all know that as naturopaths, or you work in the field of functional medicine, that we can tackle these together. Now, when I looked at the quarterlies for this, and first of all, let me say this. I'm really proud of Jamie and the crew and Joe and Christine for putting these ideas together. You don't see this from other companies. You don't see anybody having a quarterly focus that is training on how to use these preps and how to use them properly. My job is, when I was looking at the 3 quarterly focuses, is how do you find a common thread? So what I'm going to do today is share with you, as I've done in the past, the science behind this. We're going to do some studies. I'm going to read these to you. You will eventually get the links to all of these if you want them. You know, I have to scan them, and I will scan them. I promised Christine that I would. But again, what we're trying to do is tie these 3 different areas together. Now, I'm going to start out telling you a story. Here where I live, we have 54 homes. Christine's been over here and saw it's a relatively new community, but the word got out not probably 8 or 9 months ago that I was the doctor on staff here for this area. And about 6 months ago, I was told about a young lady, 32-year-old woman up the street from me, about 4 houses down, that was having rather serious cardiovascular problems at age 32. Never met her. I just said, you just have her call me and I'll see what I can do. Well, about 3 months ago, I was out walking the dogs and I ran into her, and I had never met her before. And she started telling me all about her having allergy issues at age 32. She's single, living in this place with her doggies, and she was having serious allergy problems and asthma. Then she also related the fact that she had a bad back already at age 32 and was looking at the possibility of doing some repair to the lower part of her back. And she was in excruciating pain at all times. And then she started talking about the cardiovascular problems she had, irregular heartbeat and clotting factors at age 32. Now, when you think about what she just told me, she had allergies and asthma. She had a bad back and bone issues and arthritis. And she also had cardiovascular disease at age 32. So I put that in the back of my mind. And when we got this topic for today, I wanted to dive a little bit deeper. And that was the purpose of doing this here on a Friday morning. Can we dive deeper into the science behind this? What is the link between those 3 things? Is there a link that this young lady needs? Or should she go to 3 different specialists? Which scared her at age 32. So she shared with me something that she sent down to me, and she said, I don't have a train of thought. I have 7 trains on 4 tracks that narrowly avoid each other when the paths cross, and all the conductors are sitting back screaming. And she said, every doctor that I talked to, every specialist that I talked to, kept referring me back to the other doctor. So here's a few thoughts. 121.5 million adults in the United States have cardiovascular issues brewing, either currently or on the way. That's 48% of the American population, and that includes all children. 101 million people suffer from allergies and asthma every day. If you do the theme of those 2 together, cardiovascular disease, asthma, and allergies, that takes it up to 156 million people. That's over 50% of our population. There's 50% of the population out there that come in to see you or talk to you that are having these kind of issues. So when we look at the risk factors from the Mayo Clinic for cardiovascular problems, we start out, and I'm going to go through this list quickly. High blood pressure, number 1. Diet, number 2. Cholesterol issues, number 3. And believe it or not, number 4 from the Mayo Clinic in the links to cardiovascular disease, allergies, air pollution, immune system problems, and asthma. 5 is high body mass, 6 is high blood sugar, and 7 is kidney function. 8 was joint and bone inflammation. So this has been recognized by medicine for some time. So what I'm going to do is go through some of these studies. Then I'm going to give you my protocols for that young lady that might be a little applicable when somebody comes in to see you all. Then I'm going to go through the various steps and the questions that need to be asked. So we'll go over those as I go through these studies, and we'll come back. We'll come back to these at the very end. We have got about 15 slides to share with you all that will tie in a lot of what I'm talking about to the various products by Nutritional Frontiers.
Dr. Len, that was quite a list. Can you run through that one more time?
Sure.
The top 8 from Mayo Clinic.
Top 8 from Mayo Clinic. Number 1, high blood pressure. Number 2 was diet and nutrition. Number 3 is cholesterol issues. Number 4, allergies, air pollution, immune system, and asthma. Number 4, risk factor for cardiovascular disease. Number 5, high body mass. What was last quarter's? Talking about how to get somebody to get their lives together and get their body mass down. Number 6, high blood sugar. Those two went together when we talked about thermogenesis and nutraglutide. 7 is kidney dysfunction. And 8 is bone and joint. So it's been recognized. Again, specialists galore. We're gonna come back to that in a little bit. Story number 1, written by Dr. Stephen Sinatra. If anybody has ever read the books that Stephen Sinatra has written on cardiovascular disease, he has a new one out called Allergies and Heart Disease, The Surprising Connection. He goes on to say, according to the American College of Allergy, Asthma, and Immunology, allergies affect over 100 million people in this country. So whether it's pollen, mold, animal dander, or dust, what happens? The body starts to produce, in this mode of allergy issues, starts to produce immunoglobulin E antibodies that trigger your body's release of histamine. This triggers an inflammatory response in your respiratory system, which is why allergies cause congestion and difficulty breathing. Now, that histamine release flows down and causes your systolic blood pressure to go up. What's number 1 on the list? Risk factors, high systolic blood pressure. Question number 2 in this study is when the histamine release gets so great, you can start to have heart palpitations. So Sinatra goes on and says, how do you work with this? How do you start out? Flush out the irritants, use something like a neti pot, eat an anti-inflammatory diet. And number 3, give your body the right nutrient supports. Nutrients that can help your body respond properly to allergen exposure and reduce inflammation in the body. We're going to use that kind of a concept when we talk about the protocols that we can come up with. Study number 2 by Katie Glenn, Dr. Katie Glenn, American College of Cardiology. Very traditional. History of allergies and asthma associated with an increased risk of high blood pressure and heart disease. For patients with allergic disorders, routine evaluation of blood pressure and routine examination of coronary heart disease should be given by clinicians to ensure early treatments are given to those with hypertension or coronary heart disease. Previous studies reported an association between allergic disorders and cardiovascular disease. Isn't it amazing that that's something that's never been addressed? I've never seen physicians talk about that. I come in, I got heart palpitations or issues dealing with the heart. Well, do you have any allergies? Well, what do we do then? We send you right over to the ENT. Researchers have found a history of allergic disorders was associated with an increased risk of developing high blood pressure and coronary heart disease. The most actively seen group was the males between the ages of 39 and 57. Asthma contributed most to the risk of high blood pressure and coronary heart disease. Study number 3. This is done by a Dr. Sandy LaMotta. This was published April 12th of this past year. Allergies, asthma linked to heart disease. Adults between the ages of 18 and 57 who are suffering from allergic disorder had a higher risk of high blood pressure, according to research presented at the American College of Cardiology and the Korean Society of Cardiology Spring Conference. Asthma was the highest risk. Previous studies have found a correlation between allergic disorder and heart disease. In addition to the risk of high blood pressure, the researchers found a higher risk of coronary heart disease for people between the ages of 39 and 57. That's a group that typically is struggling to even come in and see us. Now, this young lady down the street was 32 and fell into this category. So don't just push aside males in the family. I know in most cases, if the way my practice went for the last 20 years, it was 90% females that came in. They made the health decisions for the family. But we have to pay attention to the male in that family, especially in that age group, 39 to 57. Coronary heart disease occurs when plaque builds up in the walls of the arteries that supply blood to the heart. Strong link between increased plaque formation due to lack of oxygen in the body. Histamines, for example, boost blood flow to the area where the allergens attack and causes the immune system to send antibodies, triggering inflammation, which ends up at the heart. That's why many allergy medications are antihistamines designed to counter that inflammatory response. How does medicine treat allergies? Oftentimes steroids. Here's the problem. Steroids increase blood pressure. They increase blood sugar. And both high blood pressure and high blood sugar levels are important risk factors for coronary artery disease. And now we add the risk factor for a stroke. Now, that builds a pretty strong case for allergies in coronary heart disease. Now I'm going to shift a little bit to arthritis in heart disease. Another one that's very rarely looked at. Arthritis might be a joint disease, but the effects don't stop there. Inflammatory forms of arthritis like rheumatoid arthritis, psoriatic arthritis, gout, and lupus also put you at an increased risk of heart disease. That includes heart attack, stroke, atrial fib, and heart failure. It's estimated that people who have arthritis, listen to this, people who have arthritis are at least 50% more likely to have a heart attack compared to those who don't. And I know a lot of us will see those patients and we'll just say, how do you deal with this? I've got joint issues. Well, let's start you on some HA+. Do we dive deeper into that and say, do you have any coronary heart disease? Do you have anything in the family tree? Did we talk to you about this at all? This review and meta-analysis involved more than 30,000 patients, found that heart disease was 43% more likely to develop with people with high levels of inflammation in their joints than the general population. Now, how does medicine deal with this? The newest way you see the commercials on TV are called JAK inhibitors, Xeljanz, that whole risk. Those are in there for dealing with arthritis. Number one risk factor of this category, which is the biggest burgeoning area for dealing with arthritis, is a 72% increased risk of heart attack, stroke, or serious blood clots. So we deal with this from a medicinal standpoint, and we go out and try to lower inflammation and get the joints feeling better, but we put the person at a 73% higher risk of a heart attack or a stroke. Then you have the DMARDs, the methotrexate, and other conventional synthetics. Again, a 71% increased risk of a heart attack or a stroke. Non-steroidal anti-inflammatory drugs increase the risk of heart attack and stroke. In 2018, the FDA cautioned that non-steroidals can lead to life-threatening heart events with just a few weeks of use. Well, just take some ibuprofen. It's safe. A few weeks of use and a 50% increased risk of a heart attack or a stroke. In steroids like prednisone, although prednisone lowers inflammation, it also raises your blood pressure, increases your cholesterol levels, and hardens the artery. Studies have shown that people who exercise are less likely to have a heart attack or other serious health problems, according to this study. Study number 5. Don't get bored with this. Hang in there for just a minute. American Heart Association. Rheumatic disease and heart disease share common underpinnings involving inflammation. The high levels of inflammation that characterize rheumatic disease provide a natural experiment to help elucidate the mechanisms by which inflammation totally accelerates heart disease. Patients with RA have nearly a 90% increased risk of developing heart disease that is not fully explained by traditional cardiovascular risk factors. You have a patient comes in with an autoimmune issue, whether it's RA, lupus, any of those. We have to look and dive deeper to start to protect, and we'll talk about that in some of the protocols. You have somebody that comes in for this. Well, and I know we all have protocols for RA. Yeah, we'll do this, we'll do some gut support, we'll do all of this. But do you ever think about adding cardiovascular support simultaneously? Because this person is at an extremely high risk. The role of inflammation in this kind of a disease state has only been recognized relatively recent. Now, again, this article talks about using C-reactive protein, HSCRP, as one of the blood tests to differentiate whether or not there's cardiovascular issues going on. Study number 6, cardiac dysfunction and rheumatoid arthritis, the role of inflammation. I'm not going to go into this one. It's just another of these factors. This comes from the journal called Cells. I'm going to circle back to allergies because I want to try to put together allergies. Let's pull out cardiovascular for a second and talk about allergies and arthritis. Is there a link there? Does seasonal allergies, which bring about sneezing and sniffling and body aches and joint pain and fatigue, but do they boost inflammatory arthritis? Here's a question. According to the American College of Allergy, Asthma, and Immunology, sneezing, running, nose, nasal congestion, watery and itchy eyes, itchy throat. We all know that. The pollen counts are up even dramatically here because we're in a drought. When seasonal allergies strike in the spring, was this quote, I feel it in my joints and in my gut is the most common issue that doctors are hearing. Along with the sniffles and congestion, headaches, my joints get a fiery ache and I get a crampy ache in my gut. What's the issue? Joint pain and body aches are possible when allergies cause inflammation. And the inflammation, even without inflammatory arthritis, can lead to body aches and pain, fatigue, sleep troubles, skin manifestations. So how do you cope with these? You deal with the allergies. Simultaneously, you deal with the orthopedic issues on top of that. The links between allergies and cardiovascular. They call this a hemostatic system. Now, let's remember the hemostatic system is that system of our circulatory system, which is controlling blood flow to and from the heart. In addition to a well-known immunological background of atherosclerosis, the hardening of the arteries, and the influences of inflammation, there's growing evidence for the presence of links between allergies, vascular or thrombotic disorders, i.e. blood clots. This article, which was published in December 5th of 2013, talks about that and talks about how you need to get involved with lowering inflammatory markers. If you dive deep into this and they look at the eosinophils response that goes up, believe it or not, what showed up in this study is SPMs. So the links between allergy, cardiovascular, and blood clotting was lowering the inflammation using something like SPMs. Journal of Pain. Can allergies cause joint pain? I only have 2 more, so stay with me for a second. Can allergies cause joint pain? The surprising science. Evidence suggests both food and seasonal allergies heighten the suffering of those with inflammatory conditions. So how does joint pain happen? Allergies may exacerbate joint pain by creating an inflammatory response. Because your immune system views allergens as a threat, it creates inflammation to combat them. This can create or exacerbate joint pain, and that's why joint pain is common for those who have particularly bad allergies. Additional allergy symptoms of nasal, eye, chest congestion, wheezing, and inflammatory allergies. How do you treat it? Are you asking yourself, can allergies cause joint pain? Well, the answer absolutely is yes. How do we avoid? We avoid substances that trigger the inflammation. And when we have something like pollen, my goodness, we got to do something. This next article talks about vitamin K deficiency, symptoms, health benefits, optimal sources, and side effects. Now, I threw this in here because this is a rather large study that came out just about 2 weeks ago. Some of the signs and symptoms of vitamin K deficiency, trying to dispel any of the risk factors that a lot of people think come about with vitamin K. And you're going to hear me talk about using vitamin K in a lot of my protocols. Symptoms and signs of vitamin K deficiency: delayed blood clotting, bleeding, hemorrhaging, osteopenia. How many times have we had women come in, menopausal, that say over and over again, My bones are starting to get weak. I've got osteoporosis. How about easy bruising? Insufficient vitamin K can make the blood vessels more fragile, increasing the risk factors. Heavier menstrual periods, blood in the urine, increased difficulty to stop bleeding, impaired scabbing, poor bone development. Vitamin K is essential for the production of bone proteins, including osteocalcin. Now, I threw that in there because this is one of those factors where something as simple as doing a vitamin K blood lab can make a huge difference. Last study, hyaluronic acid. A lot of people ask me after the last time I did one of these is, why do you use HA plus for so many things? I used it for gut support. I used it for leaky gut syndrome. I used it for brain issues. Well beyond joints. Hyaluronic acid affects RNA network of allergic inflammation. Think outside the box, says this study from Frontiers in Immunology. Anti-allergic effects of high molecular weight forms of hyaluronic acid. In doing so, HA targets CD44, inhibits all these signaling things, and helps dramatically to lower inflammation in the body when we're having allergic issues. Now, let's go through some of these slides, and I want to talk about some of these, and then I'm going to give you some questions to ask your patients, and I'm going to come up with some protocols for you on how you do this. Now, I just want to summarize what we read from some of these studies, that you need to look at your patients a little differently now. You have to realize if they just come in sneezing, they may have other issues going on simultaneously. When you do your interview with your patients, I've got allergies. Well, how's your joints? Well, that's right. When my allergies flare up, my joints get worse. Okay, we make a note of that. We have to go into that area also. Remember what these articles said. This cardiovascular risk factor is happening in males primarily under the age of 50. So if it's a woman that comes in, you got to talk a little bit about the husband as well. Can he come in? Or is he dealing with any of these issues as well? So just put it all together that there is a direct link. And again, I want to say thank you to those that came up with this idea at Nutritional Frontiers. I know a lot of times they put together specials. These are the products that are going to be supported this quarter. These are the ones we're going to hear much more about. Air Max, etc. You go down the whole list. I don't know if really the thought process came out that when you laid out these 3 different categories, there was an amazing link there that can help a practitioner, somebody in functional medicine, to differentiate their practice from others, to pull away from that traditional medicine view that you need specialists in order to get to the bottom line. You don't. They can be handled, and we'll go through some of the protocols in a minute. Okay, let's take a look at this one. Stress is immunosuppressive. You know, I'm going to give a thumbs up to a new product that just came out, the Adrenal Glandular Plus and Adrenamax. Why? Because if you look at this, and we're talking about the one center part of the brain that controls adrenaline, noradrenaline, and neuropeptides, if you look down below, coming down the spinal cord. This is just looking at the increased risks of the adrenal glands producing these, which can cause vasoconstriction, which can lead to less blood supply to joints, which can accelerate allergic responses, and can eventually lead to cardiovascular disease, heart racing, risk factors for stroke, etc. So again, there are labs out there that control and take a look at ACTH levels, cortisol levels. We do that primarily from saliva. We can look at adrenaline and noradrenaline levels from urine. We can look at these neuropeptides and find out how well is that person's body responding to stress. And again, when you have your interview with your patients, remember, stress is immunosuppressive. So we have to make that determination. We need to talk to that patient and say, how's stress in your life? Well, I've got 3 kids and they're home, and we can hear all the stories. We can have a heart that's open to help them as much as we can. We can listen to them, tell us about all the stress in their lives, financial stress, marriage. You can go through the whole list. But again, give the person the hope to know that, yes, we recognize the fact that stress is going to affect a lot of parts of your body, and we need to control that. And it can be done properly by using the correct supplements. Okay, the next slide. Natural killer cells are the most sensitive cells to the suppressive effects of stress. Now, this is coming from the Annals of the New York Science, 1999. Recognizing that natural killer cells are our major line of defense against allergies, against cardiovascular issues. They're inflammatory, attack parts of our own blood system. And it's also our number one defense against cancer. So when we look at natural killer cells, and you look at that slide, and you're seeing a cancer cell, this is well blown up. These are excellent little pictures that shows how a natural killer cell can actually envelop and eventually cut off the supply of blood to that cancer cell and actually cause it to die off. So again, control the stress, support the immune system. We'll be talking about that in a few minutes. And you can have somebody fight the levels that have been, again, suppressed because of stress in their lives. Next cell. How do you control it? I use and I look at Air Max for anybody that's having breathing issues, anybody that has allergies. Like I took 2 this morning because I'm still dealing with pollen. I look at it as Claritin on steroids. The ingredients that in there can make an amazing change. You know, when you look at dimethylglycine is part of that, and also perilla. You know, when you look at it's called Benegut, which is the trademark brand that Nutritional Frontiers used. That's in there. A powerful antihistamine. You heard that link of histamine to so many of the things that are going on. Buffered vitamin C, alkalize the system. A non-corn form of vitamin C. Critical. When I went to Jamie a while ago and I talked about buffered C and how most times they took ascorbic acid and buffered it. And I said, no, we need calcium ascorbate, which again came from rose hips. You can see it now where there's a different source here of the buffered C, and it works amazingly well to keep the body alkalized and to stimulate natural killer cell production. Vitamin D3, 5,000. In all the seminars, everybody that we talked about back in Clearwater just a little more than a week and a half ago, we talked about the importance of vitamin D and how we can take those levels up now safely into the low hundreds for those that need support. Those that need the support that all 3 categories we talked about, vitamin D3, proven to support your immune system, proven to support cardiovascular health, proven for brain health, proven to keep the vascular system open, proven to help just in general health and keep the body as quote unquote young as it possibly can. Immunomax, I use that more acutely. Chewable form that can be used when we're suffering from something. Immune boost. Back when we were in Clearwater, I was struggling with the first time that I had gotten flu in a long time. And that immune boost puts 5, 6 different ingredients together, essential nutrients that were put together by Dr. Lori to help boost your immune system. It's a big dose. It's 5 capsules. I was taking 5 capsules up to 4 times a day till it kicked it right out of my system. Amazing prep that can support your immune system and allergies. Now remember, this is a foundation you're looking at. Look at the top of the screen. Immune, allergies, foundation. You support here, you support cardiovascular. You support here, you support joint. I want you to think about all the patients that you worked with over time. Have you ever stopped right here and said, this is where I want to start some form of this? If a patient comes in and my knees are killing me and the doctor says I need a knee replacement, what do I do? Start here. Start here Control. Well, I don't have a lot of allergies. I'm telling you, start here because there's something that's forcing inflammation and a deterioration of that joint space. Next slide, please. This is talking again about that perilla leaf extract called Benegut. Can reduce inflammation and manage histamine levels. That's why I like to call it an natural antihistamine. Research confirms that perilla leaf alleviates both allergic and inflammatory responses in the airways, reduces discomfort associated with histamine release. I want to go over this again. Mast cells, M-A-S-T, mast cells circulating in the body at all times need to become very stable because when they break due to inflammation, they release histamine. Look at a common thread between the three categories we're talking about: allergies, joint, and cardiovascular. All three are dealing with high levels of stimulation from histamine. We need to control histamine. This prep, Air Max, even if you're starting out with somebody that maybe has reduced cardiovascular functioning, and I want to start out somewhere to support them. Oh, and I want to jump on CoQ10 right away, and I want to do cardio stack, and I want to, yeah, all good ideas. Think about adding Air Max to the scenario as well, and you will have a better response from the cardiovascular standpoint when you use something like Air Max. Next slide. It's over 1,000 lab markers for cardiovascular disease. There are, and cardiologists use them all. But there's only three causes: inflammation, which we've been talking about, oxidation, autoimmune. So we talked about immune. We talked about stabilizing it with that immune foundation. We talked about lowering inflammation in the body. We're going to get a little bit more involved in that. And just for a second, we want to talk about oxidation. Oxidation causing what I like to call cellular rust, that the cells are now becoming brittle, that they're not transposing themselves by transposing DNA and RNA into new cells and turning over every 4 days, that there's becoming a lack of stabilization. And the first entity that typically shows the effects of oxidation is the heart tissue. The heart tissue starts having a harder time in the pumping of blood. It becomes weakened. So once again, if you have a patient that's coming in saying my ejection fraction dropped, we understand that that is a algorithm that cardiologists come up with on the effectiveness of the heart to pump out blood and to draw blood back in. If that number is dropping, we need to lower oxidative stress in the body. I typically will use D-ribose here. I will come in with the D-ribose powder, and I will use it at a high enough dose. I may use it 2 or 3 times a day to start reducing oxidation in the body and strengthen the heart muscle and the circulatory system. Next slide. Here's the cardiovascular stack. Cardio stack, 3 critical nutrients to support cardiovascular health. Now, dealing here, cardiovascular, blood pressure, and this is a critical one, oxygen utilization. Power fuel is that D-ribose that I was talking to you about. Power fuel is the mitochondrial energizer, the cellular optimizer. As I said, when you have a weakened heart muscle, which typically happens past the age of 50, but we're now seeing that in younger and younger and younger and younger flows. So when you use something like this, and I'm going to, I think this actually needs to have an adjunct of a 4th product in there. You can use CardioStack as a standalone if it's not that bad. So we're getting the critical nutrients in there that can help do that. We're looking at coenzyme Q10 at 100 milligrams, dimethylglycine at 300. We talked about DMG and about how critical that is for healthy cells. And then L-carnitine, but not just L-carnitine. There's a ton of L-carnitine out there. This is called the tartrate, the most bioavailable form of L-carnitine. It's a cofactor for metabolism of carbohydrates so that we can actually get the fuel to the heart muscle correctly. And then enter CoQ10, again, going to a higher dose of coenzyme Q10 to, again, strengthen the circulatory system, strengthen the heart muscle, lower blood pressure. Now, if we're having blood flow issues, circulation issues, CircuCore, Cholesterol Red, and 7 Flowers. How do I know which one to use? If somebody comes in with just slightly elevated cholesterol levels, my total cholesterol is 230, my LDL is 112, and the doctor wants to put me on a statin, the Reggie's rice that's in the Cholesterol Red can make a difference in starting to lower some of those numbers. CircuCore, because typically when you have high cholesterol and high LDL, you've got a circulatory system problem somewhere. And CircuCore, using the beet extract to improve nitric oxide, which improves blood flow and circulation. And then if you layer in paranoid schizophrenia, no, I can't say that. If you want to use 7 Flowers, which again has the longest track record out there, been around forever as far as the capability of lowering blood pressure. Now, let me just say this about 7 Flowers. Don't be afraid of going to a much higher dose. You notice there's 180 in that bottle. I've had to go as high as 6 of those 4 times a day to stabilize blood pressure. And I mean by stabilizing, I mean working both on the systolic and diastolic pressure, not just one. Oftentimes we'll have high systolic blood pressure, the top number, followed by a difficulty or a normality in the diastolic pressure. So we'll have 158 over 68.9. And you ask the question, are you on a pharmaceutical? And most times they'll be on something like lisinopril, which will lower the bottom number. But how do you go and help them on top of that medication? You look at something like CircuCore along with 7 Flowers at a moderate dose and have them monitor their blood pressure on a regular basis. The Cholesterol Red, again, I want to go back to that. I've been a big advocate. Part of my grad project that I did at the University of Cincinnati was on Reggie's rice and using the proper forms of that and dosing it properly. Now, this is not strictly a cholesterol lowering prep. It's helping to modulate cholesterol levels back to what we'll call a healthy level, as close to normal as the body can tolerate. And again, we use this typically 3 times a day to get that job done. Next slide. I want to talk just 1 second about D-ribose. Pilot study done at the University of Chicago showed it improves energy, sleep, recovery, mental clarity, and well-being. D-ribose versus L-ribose. If you look at mitochondrial functioning in the production of energy in the body, and you look at a cell taking in glucose through the outer shell wall, having it transported through and into the mitochondria, that center core part of every cell in our body that is needed to produce energy. So if you look at glucose coming in as a 23 molecule entity that enters into the cell, it goes through a 6-step enzymatic reduction. So glucose goes to 6 different steps and ends up with D and L ribose. The human body knows that it needs the D form, it's the proper form, for production of adenosine triphosphate, or the energy that's necessary for the body to operate. But we've got to get rid of that L. A lot of individuals don't have the genetic capability of doing that. So thus we end up with lack of energy, poor sleep, poor recovery, poor mental clarity. When you identify somebody that goes into that category that shows all of those, remember, if I add D-ribose, it goes immediately in through the cell wall, goes immediately into the mitochondria, and helps to produce adenosine triphosphate, which is the molecules of energy that the body needs to operate. Carnitine helps to restore mitochondrial content, helps to transport the glucose across that cell wall. Coenzyme Q10, free radical scavenger, so that it's inside of that cell. So when this whole energy production engine is working, coenzyme Q10 can help get rid of the rest of that issue, get rid of the junk that's left over, and add more oxygen into that combustion. So it's glucose to ribose, utilizing oxygen to produce energy. So this is, again, the science behind keeping the body's cardiovascular system running properly. Next slide. Cholesterol red, we talked about Reggie's rice, a dietary staple food in Asian countries, helps in various studies to reduce LDL. I've been on this prep now for 11 years. At one point, my total cholesterol was up over 300, genetics. My LDL was up over 150, genetics. And my triglycerides were up over 1,000, genetics. And I've been on this, along with a lot of other preps, to go and help the body to get down to normality. My total cholesterol in my last blood lab was 169. So my triglycerides now went from over 1,000 down to my last level, which was 57. So it can be done. This is a great adjunct that can help. Gugalipids are in there. Again, they stop the oxidation. I talked about radical oxidation, cellular rusting. You don't want that to happen to the lipids that are being produced by the liver. So again, gugalipids help to protect against that. Polycosanols have been around for years as an adjunct. They really do help, again, stop the oxidation of lipids, but they also help dramatically to lower triglycerides. Niacin, again, for circulation, it's been known forever to help support reduction of serum cholesterol. Next slide. 7 flowers, traditional Chinese medicine, relaxes the nervous system. Relaxes the nervous system. I jokingly use this oftentimes when I'm talking to Christine about how there's been studies that has been used in Europe for people with other mental issues.
Well,
Paranoia is
Len, as you know, working with Nutritional Frontiers, it's very possible to develop other mental issues.
Yes, but it does work and it reduces stress. So again, from the blue flower family of healing herbs, it relaxes the nervous system and does help dramatically to lower blood pressure. But be aggressive with this. There's no side effects that I've ever found with this. But don't tinker around. Take one twice a day. Not going to work. Have them go high first, and then we can moderate down. Use whatever dose. Start ramping it up as high as we need to, up to 6, 4 times a day. Monitor the blood pressure for 3 to 4 consistent days. Then we can start coming back down to see if we've taught the body how to keep the blood pressure correct. Next slide. Is there another slide? There it is. Now we're going to talk a little bit about bone joint solutions. I highlighted the K2. I told you about that article that I'm going to get to everybody about the importance of vitamin K2 to your bone health. Betazymes. Why is that so important? You're putting a digestive enzyme in there. Now, these are synergistic enzymes. And in particular, I like the betaine that is in there because we are using that to acidify the gut so that we can absorb more properly through the lining of the colon. So when we're going to take something like a SuperCal Plus, which has all the ingredients that are necessary, you know, when you have the menopausal woman come in saying, my doctor told me to take 1,200 milligrams of calcium, you want more than that. You don't want more calcium. You want the other adjuncts that go along with this, especially the right forms of vitamin K and the right forms of magnesium that go with that. And again, don't be paranoid about Super K2 Plus. You know, I've gone as high as 4 of those a day in various patients for a period of time, not for a long period of time, but maybe 2 weeks, so that I can keep the body in the production of right bones. Joint solutions, HA plus, small molecular weight hyaluronic acid. Small molecular weight hyaluronic acid. I use this in my gut support. I use it for brain health. Somebody comes in and we're pre-Alzheimer's. We've talked about leaky brain. The hyaluronic acid in there can make an amazing difference. We want to talk about something that helps with wrinkles, helps with joint health. It's my standalone if I have to just pick one product. Now, green lip muscle really went deep into this in Clearwater. If you haven't seen all the research that's done with this, this is, again, isolated from that muscle that you know, a lot of people do consume. This is a powerful anti-inflammatory. So when we're looking at down below where we see X-Flame, I'm going to use green lip muscle because it has the capability of transporting hyaluronic acid deeper into the joint tissue. Omegas, Again, omegas, again, for their anti-inflammatory issues. It's been well known that the higher levels of EPA, which is high in that omega-3D, can make an amazing difference in reducing inflammation in the joints. Inflammation solutions, SPMs, I will oftentimes substitute SPMs for the straight omegas as a joint solution as well as an anti-inflammatory. I will also use SPMs in the bone solutions that they're at the top. There are studies after studies about SPMs enhancing bone repair, bone and joint repair after surgery, making an amazing difference. So SPMs cross through all these categories here. X-Flame, somebody's coming in, wants to use ibuprofen. I'm using X-Flame and telling them to go as high as necessary to reduce inflammation in those parts of the body, even for muscular pain. Again, Inflam, I will use oftentimes if we have a combination of joint issues as well as muscle and ligament issues as far as inflammation as well. Next slide. Vitamin D, I talked about. Vitamin A. Don't often talk about vitamin A, but again, it supports the activity of what are called osteoclasts, which are the breakdown, that tear away old tissue that allow the osteoblasts to come in and start remodeling bone to make new. A lot of people have been paranoid about vitamin A because there's been studies out there about it causing difficulties if we go too high. This is just a small amount that is necessary to play a role in this particular prep. Next slide. HA Plus comprehensive dietary supplement using BioCell type 2 collagen complex. If you've done any research work on collagen, you're going to see that there's type 1, type 2, type 3, type 4, type 5, all different collagen matrix. Type 2 is the one that has been of the highest patented usage for repair of tissue, a torn meniscus, a bicep muscle that has been torn. So again, this protects around joint health. So when you're looking at supporting, let's say a knee or an elbow or a wrist, it's one thing to get the hyaluronic acid into that joint. It's another thing to support the ligaments and complexes around that can pull away so that we don't have so much pressure on that joint itself. MSM has been known for years. Again, another source of sulfur to help the body's ability to synthesize collagen. Again, for that connective tissue that we're trying to build up using that collagen matrix. Next slide. SPMs, hopefully you're well aware of these by now, pro-resolving mediators, known for orchestrating or mediating the resolving inflammation, chronic systemic inflammation. They extinguish the fires of excessive inflammation. And once again, do not be afraid to go to a higher dose here. When I had my broken ribs, I went to 2 capsules 6 times a day. Just the other day, I was shoveling some dirt. I don't know why, but I was out shoveling dirt and I pulled a shoulder muscle. I came in and took 3 and I repeated it 2 hours later. Extinguished the fires and the inflammation that I had in my shoulder returned back to normal. It's one of the most powerful preps that I've ever used, quite honestly. Next slide. X-Flame, multiple mechanisms of action using selazine and dimethylglycine, a patented fatty acid complex, studies, for inflammation, pain, swelling, stiffness, and dimethylglycine, again, patented forms used oftentimes for autoimmune issues like rheumatoid arthritis or any other inflammatory disease. It modulates cytokine production, acts as an antioxidant as well as an anti-inflammatory agent. Next slide. Can you play that one?
Hi, I'm Bethany Miller. I'm a pharmacist. I own Lion Pharmacy in Red Lion, Pennsylvania. And in December of 2020, I was walking into the pharmacy and I missed a step and fell and broke both of my arms. I did not want to go on the oxycodone that they gave me for pain, so I called my representative, Mike Gallagher, and he recommended the X-Flame, 3 capsules twice a day until the pain was better, and then 2 capsules twice a day. So that's what I did. And it really didn't take too long, and I was able to go down to the 2 capsules twice a day. He also recommended 3 of the Super Cal Plus twice a day and 1 of the Super K Plus twice a day for the healing of the bones, and that really worked well. Also, it didn't take as long as the doctors thought it would for me to heal.
Powerful testimony.
So the Nutritional Frontier products were excellent. I'd recommend them to anybody.
We have another one coming up, another testimonial.
Well, Dr. Len,
Well,
we are 2 minutes to the top of the hour.
okay, here we go. Give me 2 minutes.
Well, there's no time for questions then. But keep
All right,
rolling.
just real quick.
One more testimony.
Here we come. How do I treat this? What are the protocols I come with? Number one, you got to interview the patient. I start out asking about joint health, even with this 32-year-old. I then talk about breathing. I talk about allergies and asthma. I talk about inflammation anywhere else in the body. Then my fourth question is there any history of cardiovascular disease? Any history of family links to arthritis or autoimmune disease? Step 2, after the interview, I review labs. I'm looking for elevated monocytes, high specificity C-reactive protein that's up, white blood cell counts up, and then I look at the kidney numbers as well, BUN and creatinine. Critical factors to help me move to the next level. Step 3, realizing that cardiovascular disease is the number one issue that I have to concern myself with. So all my patients start out with buffered C, 1 to 4 a day for alkalizing of the system. All my patients start on cholesterol red, 1 to 2 twice a day for the cardiovascular support. And all my patients start on the CoQ10 and dimethylglycine combo at 2 a day. Now, after 30 days, I layer in, again, as I wait 30 days, then I add in the proline greens and the ultimate shake on top of that. So that's my foundation if I suspect cardiovascular disease first. Question number 2 then, do I treat the allergy next? Probably not a bad idea. So if I'm dealing with asthma, I'm doing that. I look at it. My 3-pronged approach has been HA plus, 1 to 4 a day, Air Max, 1 to 4 a day, buffered C, 1 to 4 a day. I stabilize the allergy. So if I'm working over here to take care of the cardiovascular, and I know we're starting to add up to a lot of different supplements, but most times the allergy one will go down to a stabilization. You notice buffered C was into both of those. And then finally, if we're looking at the nature of bone and joint issues, I'm looking at their diet. I'm using HA plus and X-Flame aggressively. And then with every single bone and joint issue, I'm adding the ultimate shake. I'm going in with the ultimate shake because I'm giving the body all the micronutrients it needs to start to rebuild. That's my protocol. But again, looking at them together, and don't overlook the fact that all 3 of those can be linked together.
Well, Dr. Len, that was awesome. I feel like we know this quarterly focus even better now. I know, mind blown, exactly. We will make sure that we follow up with your unique protocols and references to the studies that you started out with. Again, if people want a little bit more information on the bone joint inflammation solutions, or you want to put videos running in your lobbies about what we have focused on this quarter, they are listed on our website, and we're happy to support you any way we can. In the next couple minutes, does anybody have a question that they just want to unmute and ask, or do they want to put anything in the chat? I know I took a ton of notes. I already have a hand cramp. So good job, Dr. Len.
See the pile of papers.
There is one question.
Thumbs up.
Oh, thumbs up.
I think Marianne's given us a thumbs up.
All right.
So, well, we're really excited that we've been able to, work this into our regular training. I'm glad that others were able to join. It's nice to see some of our clients on here with us, soaking up the goodness. And Dr. Len, thank you so much for your gracious time this morning and giving us all that incredible information. I do have one question that's shown up in the chat. She wants to know if there's spotting between cycles, would you recommend vitamin K?
That's an amazing one because I've had that before where I've had some people mid-cycle, young ladies that start spotting. And as long as we know that structurally there's nothing wrong, I will actually use that vitamin K prep up to 5 times a day for about 2 to 3 days, and it stops that spotting in its tracks right away. So I have a lot of young girls that have had that kind of an issue that will have vitamin K in their medicine cabinet that if that happens again, if I start spotting and it's mid-cycle, I'll take it 4 times a day today, maybe even for one day, and that'll typically stop that.
Terrific.
That is
Good
awesome.
question.
Vivian said thank you. Oh, Rhonda's jumping in. Hey, girl.
Yeah, that is amazing. Thank you for that. That's a great pearl.
Anytime,
Awesome.
anytime.
All right. Any other questions before we wrap? Just another thank you to Dr. Len. Great presentation. Way to rock it. Way to kick our Friday off strong.
Now I can go golfing. Can I go golfing now,
Yes,
please?
you may go golfing.
Thank you.
All right, everybody, take care. Have a great Friday. Thanks, Dr. Len.
Thank you. Take care.
You.